we've got to talk about these so-called GLP-1 patches that are blowing up on TikTok and showing up in your DMs. So as a healthcare provider, I want you to have the facts and not the hype. So I'm Tiffany, I'm a physician assistant, but I'm also a GLP-1 advocate. I help people get access to GLP-1s when they don't have access through traditional insurance. So if that's something that you're struggling with, there are some links in my bio that hopefully can help you out with that. But I'm seeing way too many people fall victim to the GLP-1 patch and GLP-1 drop scam. So let's get into it. Okay, first, let's be crystal clear. There are no FDA approved GLP-1s that are in a patch form. None at all, zilch. So what's actually in these patches that people are buying if not a GLP-1? Most of the time, what I'm seeing is a mixture of herbal supplements, and supplements are not evaluated or FDA approved. It can be a different mixture, but most of the time I'm seeing moringa, I'm seeing green tea extract, and sometimes caffeine. Now, all of these can cause some temporary fluctuations in your appetite and even in your metabolism, but they are not proven to do anything with GLP-1 or stimulate GLP-1 activity in your body. So true GLP-1s are backed up by large clinical trials. They have really good data to back them up and show that people can lose between 12 and 25% of their overall body weight. These patches, zero clinical trials, they're not studied, the FDA hasn't looked at them, we don't even know that they're safe. What bothers me even more is a lot of these come from untraceable companies that are not so transparent about their ingredients or their directions that they give when they send you these products. So pretty sketchy all around. Now they're using the word GLP-1 on their packaging because it is a buzzword right now. So it's truly marketing. They know people are in the market for GLP-1s, but they tend to be expensive. So when you see this patch or you see a GLP-1 drop, you think, oh, that's a good option. I'll just do that instead, especially since it's not an injection. So I think people think they're getting the same thing just in a different form. And that is not true whatsoever. So please don't be fooled by this. It is an absolute marketing scam. So to me, this is the equivalent of giving someone a caffeine patch and telling them it's insulin, which is complete neglect from a medical standpoint. But you cannot give somebody one of these patches and tell them that it is a GLP-1 because it's just not true. And I think people are actually delaying real treatment that need it, and they're also wasting their money. And I don't want to see that happen to people. So again, please don't fall for these scams. There is no FDA approved treatment that comes in a patch form or in an oral drop form. So please make sure you're getting your information from your healthcare provider and people who really care about your health and want to see you do well, not just make money from you. So if you like this content, then please follow me for more. And I hope everybody has a good night. Thanks.